Today's workshop is Residential Placements. What should families know? I'm excited to introduce you to Alicia Hanrahan, Interagency Coordinator and Education Programs Manager at the Vermont Agency of Education. Alicia is part of the new Safe and Healthy Schools team, which covers topic areas such as chronic absenteeism, behavioral threat assessments, hazing, harassment and bullying, mental health, and school safety. She has been at the Agency of Education for 27 years, the first 15 in special education monitoring and the last 12 immersed in interagency work. Alicia is part of the Case Review Committee, the CRC, which helps place students in residential facilities, and is also the co-chair of the State Interagency Team. Thank you so much for joining us today.
All right, let's see if I can make this work. Okay, if somebody can let me know if that worked. Thumbs up.
Looks good. Yep,
Yay.
looks good, Alicia.
Fantastic. Okay, so good afternoon. I'm Alicia Hanrahan, as Karen mentioned. I've been with the agency for quite a few years. And so what I would like to do is talk a little bit about the original intent was on discharge planning, but there were some questions that folks wanted answered on kind of how you get to a residential placement for students. And I can see a couple people on here that I might jump to see if they can help me. Jessica Coleman, I can see you from mental health. Love that you're here. Thank you. I may lean on you a little bit for the CRC placements at the local level. And Jessica Puckett, thank you as well. She is from North Country Supervisory Union, and she has also placed a student residentially from the LEA perspective. So what I'm going to do is I'm going to run through the slides, and at the end, if there are questions, I don't mind if you interrupt and ask additional questions as we go along. I tend to talk a lot, so if you need me to stop, that's fine as well. So we're going to go ahead and start on the agenda. And so what I really want to get across to everybody is there are different ways for a student to get to a residential facility. Really three different ways. One is through the Case Review Committee. I'm going to refer to it as CRC. That's the most prevalent way that we have for kids to get to a residential facility, and I'll explain that a little bit later. There's also the LEA placement, where it's strictly a school district placement. And for those of you who don't know what LEA means, it's Local Education Agency, which is essentially the school. In Vermont, we have school districts, we have unified union school districts, we have school buildings. I'm just going to call them probably LEAs just to make it a little bit more simple. And then we also have kids, and this is where I also may lean on Jessica Coleman from Howard Center about private insurance. This is an area that's come up a little bit more in the last few years, and it's kind of a quirky process. So we'll talk about that a little bit. And then we'll also talk about discharge planning. So once the student goes to a residential placement, regardless on how they got there, what are some things that we need to do before they go? What are some of the things that they need to do while they're there in anticipation for coming back? And then what are some of the things that when we're getting a little bit closer to discharge, what are some of the things that we need to do on the ground back at home, whether it's working with the local designated agencies, whether it's working with the school, working with the family. So there is on our website, and I put it in here somewhere, a link to the actual document that was made. So it'll be in here, but it's also on the Interagency website at the Agency of Ed. So if you can go there, you can certainly get access to it there. And it's a several page document, and it's kind of broken down into different sections. We're gonna gloss over some of that, but if you want more information and more detail, I would take a look at that document. So we're gonna first start about the three different ways for kids to get to residential. So the first one is through Act 264. And for those of you who don't know what that is, it's an act that went through the legislature back in 1988. And it essentially was specifically for kids who were kind of falling through the cracks. There's a variety of different pieces and parts that came with Act 264. We wanted more parent voice. We wanted to make sure that different agencies and schools and families were all talking together. There was the State Interagency Team was created, the local Interagency Team was created, and the Case Review Committee was created out of Act 264. And essentially what that does is that brings a variety of people from mostly state government, and it brings us all together, and it gives us an opportunity to spend some time talking about some of the high needs kids that we have in Vermont. So on this slide, you can see who's there. We have a parent rep. We have myself from education. We have, I believe, 4 folks from DCF central office, 4 from the Department of Mental Health, more central office folks, 1 from developmental services or DALE. And then we have somebody from the Department of Substance Use and Prevention. She does not spend a ton of time, like she doesn't present. Education doesn't necessarily present cases, and neither does the parent rep. But we're there more in a supporting role than anything. And then the top 3 from the Agency of Human Services, they're the ones who actually do the presenting of cases to the entire team. People have heard me say this before. This is my favorite meeting. It's every Wednesday morning. We block off 3 hours, 9 to 12. We usually go a couple of hours. It's my favorite meeting because it's an opportunity to do a variety of things. One, you're getting some information about some of the toughest kids who have gone through hell and back. And so what can we do to help these kids succeed academically, socially, emotionally, behaviorally? This is really an opportunity for us to kind of rally around a kid and a family and see what we can do to support them getting developing coping mechanisms and supports to be able to move kind of forward in their life. The people at the Case Review Committee, I think, are some of they're tough as nails, and they really care about these kids and families and want to do the best. And so we're not necessarily always looking at kind of like the big overarching picture of what's happening in Vermont. We're really focused in on individual kids and families, which to me is crucial. And it's a kind of a heartwarming process. And
Alicia,
maybe I'm just a little crazy too.
So Alicia, there are a couple of comments that pertain to the slide. So I think you can answer this one. Can you please clarify if this is regarding housing options for adults? And I'm wondering if I misunderstood what residential placement meant here. So
Yep, that's a good question. So this is just for students. I would say that the youngest we've had is probably 5 or 6, and then we send them to a short-term assessment. And the oldest is probably they're under 21. They might be they're still in school, so they might be 18, 19, 20. That's kind of on the high end. But yes, this is just for kids who are in school or students in school.
Right. The second one is a comment. I think you'll talk about it generally. It's not a question. I'm concerned about the restrictions involving Medicaid. Many services and benefits require the individual to be covered by state Medicaid. This is discriminatory and exclusionary, cutting families off from services unless they're relying on the state program. And I do know you have a slide later on that talks about private insurance, but I just thought, so you will be talking about that a little later on.
I'm going to be talking about that. And the first thing that I can say about it is the Agency of Education doesn't use Medicaid. So to be completely honest, I definitely hear what you're saying, and I understand why you're saying it and how you're saying it. And that's not something that education really, because we don't use Medicaid funding, I don't know a lot about the rules. And it's a fair comment, for sure. And I will talk a little bit about that. So taking another look at the CRC, these kids might or might not be eligible for special education. Most of the time, I would say probably 3/4 of the time that they are, but not always. There are, what we end up doing after we hear a case presentation is really to look at the program. So once we get those case presentations, sorry, I lost my train of thought. We take a look at kind of our plethora of options when it comes to residential placements. So there are some places like the Vermont School for Girls in Bennington only accepts girls. So you might have Pine Haven in New Hampshire, which really takes a look at boys up until, I want to say, middle school, and they focus a lot on kids with sexually reactive or sexualized behaviors and fire setting. So we take a look at what the presentation says. We try to match them up with specific programs that we think the student would benefit from. Oftentimes we have to come back and do what we call a re-clear, which is essentially there's too long of a waiting list. Kids get denied placements based on acuity level. They might not fit into the current milieu that's available. They might have other students there that they knew in a previous life, so it might not be a good match. There's a variety of reasons why a residential placement will deny them. Running back up to the Medicaid, yes, students have to have Medicaid to be able to go through this process. They may have private insurance as well, and we'll talk about that a little bit later. But the primary use for for treatment is Medicaid. I think AHS uses some general funds for room and board, but the treatment piece does come out of Medicaid. And then the Agency of Education picks up any of the education costs, regardless as to whether or not they're on an IEP, a 504 plan, or if they're a gen ed student. There are times when kids will be removed from kind of our CRC list for whatever reason. They find a group home that might be a good option. They might have, DCF might find a more stable foster placement, or might move out of state or move across the state into a kinship care home, things like that. So sometimes kids do come off the list for CRC, but more often than not, we find kids residential placements that match the needs that they're exhibiting. Sometimes it does take a while because sometimes there are a variety of different reasons why kids can't necessarily go to those placements. So and for some kids, they're tough kids to place. So we might be looking at 13, 14, 20 different placements to see where we can find something that's appropriate. And that's really frustrating for the local team. And it's frustrating for CRC as well, but it's also, it's stressful when you're sending out so many referrals and sending out options to teams to say, try this place, this might be an option. And it's frustrating because it means that kids go without some treatment in a program that will help meet their needs.
Okay, Alicia, I just wanted to just point out, Jillian has posted a couple of times. She noted the students must have Medicaid on the previous slide.
Yep.
And, you are talking about in this, but in this one, in the next slide, the one with the Monopoly guy, you are talking about the difference between CRC and AOE. So I think, Jillian, does that answer your question? Because you're saying this contradicts the statement that AOE does not use Medicaid. Am I missing something? So the Medicaid piece was about CRC. And there are, as you can see from this slide, there are two different ways placements are made. So
the way that the funding works is AHS uses Medicaid for treatment. AOE does not use Medicaid at all for the educational programming. So if we send a kid to the Vermont School for Girls, and let's say mental health sends the student, they will pay for the treatment using Medicaid funds. I think for the most part, they use general funds for room and board. I'm not entirely sure. So mental health would get that bill, and then AOE gets its own bill from the Vermont School for Girls. And we have a specific line item in our budget. Specifically, it's like $15 million for some of it goes to residential placements. Other funding goes, it's state police student funding, so that's a whole nother ball of wax. But we use that money that we get from the legislature to be able to pay for residential placements. There may be school-based Medicaid. That's a totally separate kind of process that the local school would do. But in terms of paying for the educational component in a residential facility, that comes directly from AOE and is not Medicaid billed. It's based on what we get from the legislature. I hope that helps. Just a quick little aside, like Spalding Youth Center doesn't have occupational therapy. So in the past, we have had a couple of opportunities to ask the school district. So for the most part, the school district does not have to pay any money into any of these programs for education because we get charged for everything. At a place like Spalding Youth Center in New Hampshire, they don't have occupational therapy on site or in their building. So they have an entity called, I think it's Booth B Services, that I would ask the school district to contract with the OT services. So sometimes there is a little bit of money that's paid for from the school district, but then we reimburse the school district for that 100%. So there are a couple little quirky things that go through from time to time. But regardless, we always pay 100% of the educational programming, regardless as to what it's for. If the student needs 2-on-1 or 1-on-1, we pay for that. And if the student gets there and doesn't need that support, then obviously we don't pay for it. But if the residential facility says that they need to have additional staffing, it's up to the school district to say, yes, they have an IEP meeting or a 504 meeting, and then we follow suit and pay for whatever it is we need to pay for. So those are the basics about the case review committee. I want to pause there before I move on to the LEA process. Are there any questions going back to the case review committee? Okay. So hearing none, I'm going to kind of move on to process number 2. So this is the residential review process. This is in special ed, Vermont Special Education Regs. It's also in IDEA, which is Individuals with Disabilities Education Act. So there's a residential review process that we have in Vermont where only LEAs can place a student, and it's 100% an LEA responsibility to do the majority of the work, I would say. So in this scenario, all of these kids are eligible for special education. There may be, every once in a while, there might be a 504 kid. That's a little bit different. I would talk to the school district about that. But all the ones that I've really had to deal with are eligible for special education. There's a form that the school districts fill out. I actually put the form in a link on here. So what the school districts do is they fill out the form that I have online, and they upload a variety of information that would essentially, it helps me to paint a picture of the student. So it might be something like Johnny has a severe learning disability, has an orthopedic impairment from birth, and has a hard time walking, needs a walker, maybe needs a wheelchair. The student may have ADHD. They might have a variety of issues. It could be behaviors. It could be mental health. Whatever it is, the school district will provide me with information, whether it's medical information, dental, educational, whatever kind of helps to paint the picture about what's going on for this kid. And then they send it to me, they upload it, and I go through. I have a worksheet that I use where I'm it may look silly to everybody else, but it's kind of my own process. I like cut and paste, and in my head, I'm typing out what's going on with this kid, what the family's reporting, what the school is reporting, what the psychologists, the medical professionals, whatever's kind of in there. If there's a lot of restraint and seclusion information, safety planning, coordinated services plans, all those types of things. I put them in this document, and then I start thinking about, okay, where would be a good fit for a student? Some students are much easier to figure out where to go because there are less options. So for a student who might be blind, we don't have a lot of kids who have visual impairments in Vermont who need that type of residential support. And I think the only place where Vermont has ever sent a kid is the Perkins School for the Blind. We have, half a dozen maybe schools who would accept deaf and hard of hearing kids who might use American Sign Language. They might accept kids who have cochlear implants or not. So there, those cases are a little bit, I don't want to say easy, but some of the schools I think are well known to kids in Vermont. It's where you get some of the tougher kids, I would say. And I don't mean tougher in terms of their abilities, but if they have a kid who, I'm not saying this well, a student who is deaf or a student who has a visual impairment, it's kind of most likely you're going to lean towards a deaf school or a school for the blind because that's what they need. For a kid with a variety of other disabilities, if they're nonverbal, if they have aggression, if they are on the spectrum, if they have emotional disturbance, if they're impulsive, sometimes those kids are the ones that are a little bit more difficult to place, depending on whether or not they need a little bit more therapeutic or whether or not they need more of a strict school. And so that's where it becomes a little bit more difficult with placing students, because you always want to make sure that the reason they're going to a residential placement is really because of education. And sometimes that's a slippery slope because sometimes a student's behavior, for example, might be a reason why they're not being able to be successful in a school program. We'll get to that in a few minutes. But for the most part, Vermont does not have, whether it's for any kid going to a residential placement, we do not have a lot of options in Vermont. So most likely, any kid going through a residential placement through an LEA placement, so a school placement, is going to be going out of state. And that's tough for families, especially if you're looking for younger kids. It's really hard to send a third, fourth, fifth grader out of state to a residential placement. It's hard for the family. It's difficult for school districts and IEP teams to say there's not a lot more that we can do to make sure that the student is successful, regardless as to why they want to send them to a residential placement. Again, there could be denials of options that, let me back up. Once I get done my kind of paperwork review, I will give the school district some options. And so I might have 2 or 3 options. I might have 8 or 10 options. once that happens, it's up to the school to be able to say, all right, we're going to look at these three, we're going to narrow it down to these 3 residential schools. And so we're going to do some research where we might go to visit. We might have some interviews with the students. We might, send a referral packet to the school to see if they will accept this student. And then it's really up to that particular residential placement to say, yes, we'll accept the student, or no, we won't for whatever reason. This is through an IEP team. So the school, if the IEP team determines that a residential placement is where the student needs to go, then as a team, they can certainly look at all of the options, and they can visit and they can do this, that, and the other thing. And in the end, it is the school district's responsibility to select the program. If the parents aren't comfortable with the selection, then they can certainly file for due process or mediation or an administrative complaint. The requirement of the IEP team is that everybody is in agreement that the student needs a residential placement. And then if you can't reach consensus, then it will be the local educational agency representative, who could be the principal, could be the special ed administrator, making kind of the final decision. And if the family isn't comfortable with that, then they may need to invoke their parental rights.
Okay, Alicia, I'm just going to do a quick time check. You're almost at 2:30.
Okay, perfect. Thank you. One more quick piece about LEA placements that I think is important is that the school district pays 100% of the cost of the residential placement. Once they, and that's for any LEA place, any school district placement. It's 100%. Once the school district has paid, it's a new number, I don't know what it is, it's like $67,000 and change, then the agency will reimburse the school district for the remainder of the cost over the course of the year. And I think it's right around 95% plus or minus. So if a school says we're going to pay for this, then you can be sure that they're paying for at least that $67,000 plus a little bit more depending on the cost. So if it's a $400,000 placement, the school district will have to pay the full $400,000, but they'll get reimbursed a huge chunk of it. Couple of different things.
Alicia, can I ask you a question? Sorry.
Sure.
It's Jessica.
Hey.
From your previous slide, I do think people often get even school districts get very confused about, we can place kids through the special ed process versus like if they just make a blanket statement that a kid needs residential, they then assume it has to go through the Act 264 and mental health process. Yep. So I do know that there's a lot of confusion around that.
Yep.
But I did have a school that I felt was pretty clear, and they were the school was recommending a residential level of care through the IEP process. And their statement was that they still had to have an Act 264. And I was like, I don't think you do, but
it's not a requirement, for sure.
Right.
Because if the school, ultimately what you would want to see the school do is you are primarily sending the student to a residential placement based on educational needs. Like you are not able to show that the student has made sufficient progress, and you can, I don't want to say assume, but the data that you're looking at is showing very slow progress. You certainly can have a coordinated services plan, Jessica, but why? I don't think you need to, because a coordinated services plan brings education, mental health, and the family together to kind of coordinate the services.
Right.
You might need to do that anyway, before the student goes to residential, but it is certainly not a requirement.
Okay, thank you.
Yep. So in terms of thinking about the differences between whether or not it's a school placement or a CRC interagency placement, there's a lot of things on here. about, kind of the differences. So for the LEA placement, you're looking more at the educational versus more behavioral or mental health related for the case review committee, because you're looking at mental health developmental services, or DCF, doing the actual placements. When you're looking at an LEA place kid, most of the needs are educational within the actual school district, as opposed to mental health concerns that might be present in the home, the community, and in the school. So, and then you're also looking at the severity. What the school district needs to do is be able to say, yes, we've kind of tried everything in our continuum of services. So we've had the student in the public school with support. Maybe we've, shortened the school day. Maybe we have looked at an independent school. Maybe we've looked at some partial independent school, partial online programming. There's a variety of different things that the school needs to look at. I think once you've kind of exhausted everything in your continuum of supports and services, what's next? And so I think looking at the data, making IEP team decisions, that's really when you want to start thinking, what's next? And how are we going to get this student in education where the student isn't making sufficient progress in our homeschool. In terms of the kids going through the CRC process, education is at the table, but the reason they're going to a residential placement is not because of educational purposes. They certainly might be compromised, but you're looking at more the more mental health and behavioral concerns that the student is exhibiting. So they're going through an AHS or an Agency of Human Services process instead of the school.
So Alicia, this question kind of does pertain to what you just talked about.
Okay.
Can a parent refuse a residential placement for a young child and ask that they come back to the table to figure out a local option, possibly not residential? Or are they forced to remove their child from school and homeschool? Does the school need to show they have tried locally?
I would say, so that's a loaded question. I would never want a family to remove their student to homeschool. And I currently kind of oversee the home study program, so I don't want to say anything bad about the home study program. Once you remove a student and move into a home study program, you lose all rights to special education. So that would be one of the concerns that I have. I think if you can certainly go back to the IEP team, you can call an IEP team as a parent or guardian at any time to say, we need to try something else. This isn't what I want to do. I'm not comfortable sending my kid to a residential placement. You can always go back to the IEP team. I think if the school district holds firm and says, this is our kind of what we feel is our last option, I would hate to see that happen, only because, you're having to, by putting your foot down, then it's an automatic, you have to send them to a residential facility. And I think that's tough for some younger students and families to be able to understand. Again, families always have the right to go back to their parental rights and file for mediation, due process, and administrative complaints. But I don't think it ever hurts to go back to the school district and say, can we think outside the box? Can we try this again? And maybe there's other options and maybe there aren't. But I think as a parent, I think you have to be comfortable with the decision that you need to make for yourself. And I think it's also important to understand the school's point of view. It's a hard decision on everybody's part to put them in a residential placement at any age for some kids. I think it's a little bit different if it's through the case review committee, because if you are placing a kid through mental health or developmental services, it's a voluntary process. DCF, not so much a voluntary process. And for school districts, sometimes if they feel like they've tried absolutely everything, it's tough to be able to say, we're kind of out of options. So I'm also available. I think my information is at the end of this. So if there are individual questions that folks have, I'm more than happy to answer them if you want to send me an email after that. Just kind of a fun little, couple of slides that just say, these are where some of the kids are going. We've got them going, in New England. We're southern part of the state, center of the state. The LEAs are really more closer to the Eastern Seaboard than anywhere else. So I swear I am going to get to the discharge planning, but the third piece, and this is a little bit more more difficult, but it's the private insurance piece. So for some kids, private insurance, kids might have some private insurance and Medicaid, but what you have to do is exhaust the private insurance first. And so families have to work with their insurance agencies, to find out if they actually have a residential component in their insurance policy. And then if that is there, then what they have to do is do some research and search for residential placements that might accept their private insurance and meet the student's needs for whatever issues that they're experiencing, whether it's suicidality, drug and alcohol, things like that. Some of the designated agencies have certainly helped, and there have been some case management opportunities for some families to access that can kind of help walk them through the process. They can't use the Medicaid if they have secondary Medicaid until the private insurance is exhausted. And what that means is the student has to actually go to a residential placement and use up all of their use up the service. And so the couple of times that I've been involved, it's like every couple of weeks, the insurance company and the school and the residential placement and the family will sit down and say, does the student still need this residential placement? And so they do it like every couple of weeks, which I think can be really difficult. And I think very stressful for families, not knowing how long their student will be there and will they still meet criteria to remain in that program for the next few weeks. And it's also really hard for the school district and then the designated agency back at home to know what kinds of supports and services the student will need once they come out of the facility. Again, this is not something that I'm aware of us using nearly as much as the other two processes. This is kind of not used as frequently. One of the things that happens with this is that the educational component is generally not included. It's only the room, board, and treatment through the private insurance company. So it's really important for the family to spend some time talking with the local school district and determining whether or not the school is willing to pay for the tutoring the student gets or the educational programming that the student would get while at this placement. One of the things that we kind of come back to is it really considered a homebound or hospitalized placement? And is that the kind of distinction that people have through the special ed rules? Or is it more of a unilateral placement, like the families placing them in these residential facilities? So are the families entitled to reimbursement, or is the school obligated to pay for that educational component at the program? That's a little bit more difficult to answer on a consistent level. So I think the more that the family involves the school district, just to kind of keep them in the loop. So if the families get an education bill or the school gets an education bill, everybody's kind of on the same page on what we're going to do with the bill that comes in. Because that's not necessarily a clear-cut answer for every single student. We always would recommend, yes, go ahead and pay for it, school district, but I'm not so sure that everybody will, to be honest, and depending on what it looks like, because the school isn't the one doing the placing, it's the family and the insurance company. So that's the end. And I can go into more private insurance stuff on a later date if people need me to. It's a little bit more convoluted. The other two areas are certainly much more, from my perspective, cut and dry. But I think it's important to know, like, when is it that people need to start thinking about a residential placement? And a lot of the answer is it depends. And it depends on kind of which area you're looking at. If you're looking at a CRC placement, a lot of those placement decisions are made at the Agency of Human Services and the local level for DCF mental health or developmental services. In terms of school, you're looking at IEP teams making the decision. And if you've kind of run through all of the continuum of your supports and services, then that's when you start thinking about what's the data that I have, what are the supports and services that have been put in place, what are the different things that we've tried in, thinking outside the box. Have we tried everything that we possibly can? What is the data showing? And so that's when you start making some of those decisions about next steps. I think I've talked about a lot of this. The school district has to provide a free and appropriate public education. So that's an important piece when school districts are looking at next steps. And ultimately, when it comes down to the LEA placements or the residential review placements, it's an IEP team decision. I'm not part of an IEP team. Nobody at the state level is part of an IEP team who can make decisions. So if the decision is for a student to go to residential and they're asking the state for information on options, I certainly cannot go through and override any sort of decision because that's made at a local level. I can provide feedback, I can offer guidance and technical assistance, but I can't override anything. And then when it comes to residential placement for private insurance, that's really a family and private insurance and probably the medical professionals decision on next steps for families.
Okay, and Alicia, another time check. It's about 2:45.
Yep.
So
thank you.
Yeah, if we can always continue recording past 3,
Okay.
And folks can leave if they have other obligations.
Yes.
Will be taped, but just letting you know. Okay.
See, and I told you earlier, I can talk, I could talk until I'm blue in the face, so I apologize. So thinking about discharge planning. So the decision has been made. However, the student gets to a residential facility at this point is irrelevant. Now you're talking about what are we going to do with these students once they actually get there? So what we're going to do is we're going to start looking at what do we need to the residential placement to know about the student. So I'm going to use, just for fun, Easter Seals, which is in New Hampshire, which we send a lot of kids to Easter Seals, both LEA placements and CRC placements. So some of these things are, and I said this, I gave this part of this presentation to administrators recently, but they're mostly special ed administrators. And in some respects, principals, I think, need to know a lot of this as well, because a lot of the kids going are from their local schools. And so they will also be the ones who are going to be welcoming the kids back once they finish up their programming in the residential. So they need to be kind of aware of what's happening. So I think a lot of what we do should be relationship building. So if there is somebody that the family can talk to, whether it's the family rep, if there's a family rep who's involved, is there a case manager at the local school who's talking to the student? I think it's important once the student is getting ready to go that they know that they have a specific person in mind that they can reach out to, whether it's email, whether it's Zoom calls, things like that. Everybody should be talking to the residential placement in terms of the school district. If it's not a CRC placement, the school district may want to be talking to the resident staff. So like the overnight staff might want to talk with the medical staff if they have a medical disability, or they have allergies, or if they have, issues with textures or different food types, things like that. So having kind of a well-rounded understanding with the residential staff, whether it's school residents, nursing, things like that, I think is really important. So everybody's kind of aware of where the kid is coming from, and then developing those and kind of nurturing those relationships, I always think will help when transitioning the student either home for a short period of time or back into the local community and the local school. So Easter Seals, again, Easter Seals would need information like the most recent 504 plan, the IEP, medical records. They might need information on restraint and seclusion, behavior plans, if there are any cultural considerations that they need to keep in mind, contact information. So if the school can't be reached and the family can't be reached, who might be an emergency contact? Those are some of the basics kind of before. And then also thinking about what happens when the student first gets there. Like, you probably don't need to have something like you might not need to have transportation in the IEP anymore. That might be something that you don't need. You might not need a one-on-one in there anymore. You have to change the least restrictive environment from the local school district or the independent school, or 40%, less than 40% in the gen ed environment, and you have to change that to residential. So there's always going to need to be a reason to have a meeting soon after the student gets there. I think as you go along and the student has been there for a little bit longer and the residential school has some data that they can provide, you might want to be tinkering with IEP goals, accommodations and modifications, things like that. But some of the initial things need to be done. One of the requirements in special ed regs is a reintegration plan. This is most important, I think, for an LEA placement, because what are the goals that you want the student to work on before? So that's kind of the criteria you're using to bring the kid back to the school district. So if the student has, I don't know, let's say hearing impairment of some sort, has cochlear implants, and uses some ASL, what are some of the things that you want them to be able to do for them to be able to come back? Do they need to have more proficiency in ASL? If they have had a variety of speech pathology services, do they need to be able to be more communicative and however they want to assess that? Do they need to have reading services or math services to get them to a level of proficiency? I'm kind of making this up as I go along, but in terms of reintegration plans, what you take a look at the reasons why the student goes to residential, and then you kind of figure out what are the things that you want them to be able to master or have a better understanding of when they transition back into the school district. There may be times where a local school may not have some supports and services in place. So if you have a student who might have a hearing loss, but might not need ASL, might not need any sort of cochlear implant, something like that, but they might need a hearing consultant to come in twice a year to have conversations and training with the staff. That isn't necessarily anything that might be coming through the residential schools. So the local school district would have to ensure that that happens. So there are some bits and pieces to consider. Also talking about, home visits. What's reasonable for the student to come home? Is it once a month? Is it once a quarter? How are we going to, who's going to pay for the transportation? How is the student going to get to and from? Those are also IEP team decisions that need to be discussed. if the student is coming from, say, 12 hours away, I'm not so sure that having them come home every weekend might be in their best interest. There are programs that do a lot of things in the community. They do lots of fun things on the weekends for students. So, it's a good opportunity for kids to have some of those social emotional skills and put those to use during weekends. You also need to take a look at how is the school district going to get any of that 4500 data. And again, Rule 4500 is restraint and seclusion. The residential school still needs to provide that to Vermont, the Vermont school district, if that is, if any incidents like that happen. Again, if there are any medical issues or any incident reports that come up, how is the family getting that? How is the school getting that? And then kind of what would be some of those things that, are there other things that we need to put in place? Do we need to have another IEP meeting to start thinking about next steps to do while at the residential school? And then as we're all starting to think about bringing that student back, what are some things that we need to do? Do we need to reach out to our local mental health system? Do we need to reach out for developmental services? Has the student had some medication changes that the school might need to know about? Is the student going to need a one-on-one when they get back? Do they need, and if they do, are they going to need training? Will the student be able to come back into the mainstream class, the gen ed class? Will they need something like an independent school as kind of a step down from a residential school to an independent school, and then kind of think about how we're going to transition into back into the public school? I think it's important to identify if there are people at the local school district who can help support the student in that transition. Are there certain classes that they can take that they're interested in? Is there a certain teacher that might be a good fit for the student? Do you want to start with something that interests the student, or something that's a little less strict, or something that might be a little bit easier for them to reintegrate into? It is super, super, super important if it's a high school student for that residential school and the guidance department of that high school to talk as soon as they can. And I would recommend it maybe even earlier, but at least as they're starting to talk about discharge planning, because the local school will have specific graduation requirements. And so that the Vermont school needs to be able to understand what the student has done while in residential, so then they can take some of those credits or some of those proficiencies and make sure that they integrate those into the student's transcript. So when you're talking about graduation, they've got a really good foundation from when they were in a residential program. Other things to think about too is, do you need to update a coordinated services plan, behavior plan, crisis plan? I think it's important for everybody involved to be able to use the same language that the residential school was using when they reintegrate the student back in, so the student has a much easier transition. I also think if it's if possible, if the student could come back a little bit early and maybe spend, one day a week for a few weeks attending a class at the local school, and then go back to the residential, and then just kind of build up, I don't want to say the tolerance of the school, but build up the confidence and kind of in figuring out how to best work through that, I think is always an option. You're always looking at whether or not there's going to be a new case manager. So realistically, it's thinking about, what is the student going to need when they come back? How different is it going to be from when they left? What has changed since they've been in residential? There's a possibility that the kid went from an elementary school to a middle school. So now you've got all kinds of new players. You've got, classes that are moving back and forth. So makes sense to spend a lot of time kind of thinking through some of those scenarios and what makes sense. And then again, what works for the student then may not work for the student now. So the more involved people are, again, with that developing of relationships, the more comfortable everybody is with knowing what's happening, I think the better off everybody is going to be, because there is going to be a lot of change. And I think in addition to what goes on at the school, there's going to be changes at home too. The family might have some increased anxiety. They might have a little bit of difficulty remembering what the student was like before, and then how it might change the dynamics of the family. There might be some changes in the language that they should be using if they want it to be consistent with what the student learned while they were in residential. If the student was used to doing their own laundry in the residential, which is what happens a lot of times, then should they be doing their laundry when they return home? So a lot of things, it also depends on how long the student has been there. But I think it's also important to think, when you're thinking about kind of the whole scenario, you need to include what the family has experienced in the past and what it's going to be like for them to come back. And there might be a lot of different changes. And so for everybody to be who's involved to just kind of understand that dynamic. The school district is one piece, but I think the home piece is completely different. And so for everybody to be aware that there might be some challenges with that transition home as well. 2 minutes, Karen. I didn't try to rush the last little bit, but I might have tried to rush the last couple of minutes. But realistically, I mean, this is my work email. This phone number it forwards to my personal cell. I'm more than happy to answer any questions if you want to do follow-ups. I'm happy to do whatever. I'm sorry, I spent a lot of time on the different ways to get it through residential. But honestly, I'm happy to do whatever.
Yep. So if you can stay on for a little bit and folks want to stay on for a little bit, we can, like I said, keep it open. But before that, I just want to remind folks that we do have the survey up in the chat. And I'm actually going to give you like half a minute to do the survey. I do see a couple of questions that we can bring up again after you do the survey. And then again, stay on as long as you want, but we'll keep recording. So just a few seconds of quiet if folks could take the time to fill out the survey. That would be great.
Thanks, Jessica.
Okay, Alicia, I see a question here. What should I do if I've asked for the 4,500 data but have not been provided with?
If it's from the residential facility, I would be asking for it again. So it is so for any LEA placed student, the contract that the school district has with the residential facility should include that information. So the school district should be able to access that. If it's a CRC placement, it's in the contract that they have to sign for DC. It's usually DCF who holds the contract. And so that information is in there. So if they're not providing that, I think you could go to the designated agency, whoever holds, whoever's placed the student. So if it's mental health, it'll be one of the care coordinators. If it's DCF, it might be one of their staff. And if it's the school district and folks are having difficulty getting it, again, it should be in the contract. If it's not, then I think the next time around it should be. I think ultimately if people are not getting it, and it's only for, 4,500 is only for during the school day. It's not necessarily for while the student is in the residence. which is a little bit different. There may be times when the student is out of the school, if it's an LEA placement, and it's off school hours. I don't think you would necessarily fill out a 4,500 because it's not during the school day. It's during the residence. So that's a little quirky. Ultimately, if folks aren't getting the paperwork, they can always come to me and I can reach out as well.
Okay. There were a couple of pre-asked questions. You might have covered most of it in your presentation. And one was, when is a residential program appropriate?
Yep.
And then the other one was, what criteria must be met for school placement at a residential facility?
Yeah.
So, yeah, I think you really did cover those pieces in your presentation.
Okay.
So does anyone else have any questions? For the folks who are left, you are welcome to unmute yourself and ask Alicia anything. Okay,
right.
It looks like there are no more questions. So thank you, Alicia. I think we managed to wrap everything up in just 3 minutes after 3. So thank you, everyone, for being with us. And we have more workshops that are scheduled. We hold them regularly. You can always find that information on our social media, on our website. So thank you, everyone, for joining us today. Thank you, Alicia, for the presentation.
Thank you.
Goodbye.
Enjoy the snow.